And without further ado, I'd like to introduce Dr. Herbert Silverstein. He's the president and founder of the Silverstein Institute and Ear Research Foundation. Dr. Silverstein has been a leader in the field of neurotology and is the inventor of many surgical procedures that have improved the quality of life for many patients. He has authored 245 scientific papers and 6 books. Please welcome Dr. Silverstein, who will talk today about his latest innovation, which has been to develop a minimally invasive surgical procedure to reduce the symptoms of severe hyperacusis or noise intolerance. Dr. Silverstein?
Thank you, Jennifer. Welcome, everybody. How many people here are new, not our patients? Okay, good. How many are our patients? Okay, great. So what I'm going to do is to give a short talk about hyperacusis and what it means, and then we're going to have a video of a patient that we did this summer who lives in California. He wanted to come and tell his story here, but we told him just to send a video because it seemed like too hard for him to do that. And then we're going to have the panelists talk and tell their story about how the hyperacusis has affected their life and what the surgery has done for them. So there are actually 4 types of hypersensitivity in the ear. First is hyperacusis, recruitment, misophonia, and phonophobia. And I'm going to talk about each one of those things to try to explain them because they're all a little different. So hyperacusis is when a person can't tolerate normal sounds. They become very anxious and they avoid places like movies, restaurants, and sporting events. It often affects their quality of life, and it's said that 6 to 17% of the population have this. This can occur in patients with normal hearing or with hearing loss, with sensorineural hearing loss. When we do what we call an uncomfortable loudness test, we put sound in your ear and we just keep raising it up until it becomes uncomfortable to you. Most of the people, normal people, can tolerate 90 to 100 dB of sound in their ear. But people with hyperacusis, their ULLs are below 90. Many of them have tinnitus and ringing in the ear along with it. And the treatment has been difficult, but they have used earplugs. There's what we call tinnitus retraining therapy, cognitive therapy, and it's all a long-term treatment. And the results are variable and sometimes they're not effective. The recruitment is the second type. Recruitment is a sudden increase in sound and occurs when the noise level reaches the patient's hearing threshold. They usually have a hearing loss, and they usually have Meniere's disease in the ear, too much pressure in their ear. When the sound comes in, all of a sudden they're startled by the sound. Phonophobia is a fear of sound. They're afraid of sounds. And misophonia is a dislike of sounds. Now those two, recruitment, phonophobia, and misophonia, don't respond to the treatment that we have developed here. So the causes are mostly unknown. Head injury sometimes causes it. Trauma to the inner ear. SSCD is a fistula of the superior semicircular canal, which is something that we're finding that people have. Fistula, leakage of fluids of the inner ear. And some medications can cause it. And recently we found that the stapes bone, the little stapes bone, which I'm going to show you, is moving too easily. And so when the sound comes in, the stapes wiggles a little bit too much, and that's why you have an increase in sound sensitivity and you have the hyperacusis. So the possible mechanisms are that there's neuroplasticity and noise suppression. There's impaired suppression of noise in your brain. and that the hypersensitivity of the cochlea to sound, there's hypersensitivity of the cochlea to sound, and that if you can put some tissue on top of the little windows, you can reduce the vibrations going into the inner ear and reduce the hyperacusis. And hypermobility of the stapes is another thing that we've found recently. So the first patient was operated in 2009. He had an auto accident, hit his head, and he had severe noise intolerance after that. And we placed tissue in his windows, and the patient reported immediate improvement. 5 years later, he's doing very well and has no symptoms. This is a picture of his surgery, and this just shows you some of the tissue that we put in. You'll see that. So the literature, we searched the literature, we didn't find any patients, anything that was written up about this. And we found one case where there was a fistula of the canal and the patient had hyperacusis and was helped by this procedure. So we decided to do a study, and we have about 25 patients now that are over 18 years of age. And we've got approval from the hospital board to do the study. And what we do is a hearing test. We do this loudness, uncomfortable loudness test, a CT to make sure that fistula is not there, and then the patients fill out a hyperacusis questionnaire and a anxiety and depression scale questionnaire. And we do these tests at 1 and 6 months after surgery. So this shows you the surgery a little bit. We take a little bit of tissue from right above your ear here. It's over your muscle. And we have a punch. We call this a skin punch here, and it makes these nice little circle of tissue that we can move. And this is a right ear. This is a little incus bone and the stapes, and this is the round window. And so this is one window, the oval window, and the round window. And so here you can see the tissue that's temporalis fascia tissue placed in the round window, and here's the tissue on the stapes. And this is decreasing the patient's tolerance to noise. So I'm going to show you what this looks like, and hopefully this will work. Okay, see I'm moving the stapes now. You see how I'm pushing it with the instrument? That's more movement than is normal. Usually the stapes does not do that. So in this one, this is after the surgery, after the procedure. I'll just wait till this finishes here. Take another second. And then this one shows you the decreased movement. So the tissue's placed all around the stapes, and you can see that pressing on the stapes, that the stapes did not move as much. And this patient was one of our first patients and was very happy with the procedure. So all the patients that had that extra tissue placed around the stapes have done very well. So the 6 months results in 10 patients with 14 ears, 7 of the 10 reported subjective improvement. One patient with misophonia did not improve, and we had 2 patients that had very low, very hypersensitive ears that were not helped by the procedure. They also noticed that in the other ear, the second ear, would be improved by just operating on the first ear. And many patients with the bilateral hyperacusis asked for the second ear to be operated. And there's been no hearing loss from it. So this shows you the questionnaire. The high numbers here show a lot of problems, and then as time goes on, at 6 months you can see things sort of quiet down and patients have less problem. And this graph just shows this is the tolerance to sound before surgery, and this is the tolerance to sound. So you can see that they improve in the noisy situation. This is another questionnaire, again showing in both ears operated how it decreases over time. So it takes a little bit of time for the ears to get used to the surgical procedure. So, in conclusion, the 7 out of the 10 patients had significant improvement. We've done many more patients up till now. Hearing test is essentially unchanged. The uncomfortable loudness test was improved in all the patients that got better. Quality of life was enhanced, as you'll hear. And the one patient that was unimproved had misophonia, and the 2 unimproved patients had ULLs that were below 50. So, you know, you and I are at 100, normal, and then these people were at 50. So they need extra tissue placed in their ear to make them better. The tinnitus was not changed by the surgery. Okay, so that's my little talk, and what I'd like to do is to play the video.
Hi, my name's Dave Kramer, and I have had hyperacusis for over 30 years. And I'm so happy that I had the surgery done with Dr. Silverstein at the end of August. So I wanted to do a short video for you to kind of compare what my symptoms like prior to the surgery and then what I'm feeling after the surgery. So I'll just start off by saying it was really, really fantastic. I'm so happy that I went through with it and did it. I was a little skeptical at first because I wasn't sure if my symptoms matched other people's, but I just want to share with you what it was like kind of living with hyperacusis and some of the symptoms I had. So first of all, obviously I had this very high sensitivity to sound. Not only sharp sounds would bother me, but also just walking into a large room or even a small restaurant with a lot of people talking and just background noise and clanking dishes and everything like that. So it was very, it could be sometimes painful to sit there. A lot of times it would just kind of get numb as I was sitting there, and then my ears would ring. But the problem really that affected me the most was after, like the day after I went out, whether it be to a basketball game, a restaurant, a bar, anything that was any social event, my ears would almost like fill up like they were in an airplane, and then sounds would be super sensitive for days on end. And so I had to really be careful where I went. I wore musicians' earplugs, and that kind of got me through life. And it was just, all my good friends and family know that I was just super sensitive to sound, and if you would drop a fork into a sink, it would really kind of send a sharp pain, almost like a chill would go up your spine. So that's kind of what it was like to live prior to that. And then when I found Dr. Silverstein, I had the surgery. The surgery was very minimal, really, as far as pain. There was no pain at all. When I went through the surgery, I stayed in Florida for about a week before I flew back to Arizona. They took the packing out of my ear, and I noticed immediately that, especially driving from Sarasota back to Tampa, I drove over that large bridge, and it has kind of a steel grate to it, and in the past that would really hurt my ears and make my ears kind of almost flutter or just feel super sensitive. And I noticed when I was driving over that bridge, it did not do that. And so I was like kind of getting excited just driving over that bridge, thinking like, wow. And so I rolled my windows down, which I hadn't done in years. I hadn't ridden in the car with my windows down, because that would also hurt, affect my ears and make them very sensitive. So I rolled my windows down, went over the bridge, and I called my wife when I got to Tampa and said, I actually think this really worked, but I haven't really tested it. So over the past few months, because like I said, I had the surgery at the end of August, I've been to several different loud bars and restaurants and sporting events and just everything that you would normally do in life that I kind of stopped doing because I couldn't go into those places. It's been just fantastic. I don't feel any pain. First of all, I don't feel any pain while I'm sitting there. And I know as sounds hit my ears, it doesn't affect it like it used to. It almost feels like the noises that come into my ears, what used to be very sharp tones, are kind of like dumbed down now. I can still hear them fine. It's not like I feel deaf. I just feel like the tones are more muted or dumbed down. So that's really the best way that I can describe that. And then really the true test is, when I would wake up the next day, I wouldn't feel any pain at all or any fullness in my ears, no sensitivity that went on for days. And it's been just a blessing, really, that I found Dr. Silverstein. I think he's an innovator, and he's my hero for sure, because it's changed my life. I can't even tell you how it's changed my life in the most positive way. I'm doing things now. My wife and all my friends and family have noticed I'm much more relaxed, because prior to this I was very tense, or I would get very anxious being in a place, because I'd always want to leave because it just wasn't comfortable to sit there. So I'd always kind of rush my wife out of a place, like, are you ready to go? I've really got to get out of here. And she understood and was great, but now I'd want to stay, and I'm much more relaxed. And so if anyone is considering doing this surgery, I would say it worked 100% for me, and it's just been a total game changer, and it's changed my life in the most positive ways. It sounds silly, but I'm riding in the car with my windows down. I'm listening to music again. I went to a concert where they had violins plugged into speaker, and that was some very sharp tones that didn't hurt my ears at all. And I can tell you, Dr. Silverstein and his whole team just gave me my life back. So I just want to do this short video and tell you, if you're considering it, please do it. I think it worked for me, and I'm so happy that I found him. So thanks again to Dr. Silverstein and his whole team. It's been a game changer. Thank you.
Hello, my name is Alona Wicks. In June of 2015, this man, Dr. Silverstein, changed my life. I came to him in desperation for any relief at all. I have had hyperacusis for many, many years, possibly since I was 2. Actually, I have other sensory sensitivities, but my sensitivity to hearing was the most annoying and debilitating. In high school, I was overwhelmed by typing class and the sounds of the keys of 40 typewriters and the bells and whistles. I remember walking down the street and jumping out of my skin at every car horn, coming awfully close to being injured. I do not drive because of this, because of the road noises are too distracting. I also have come up with other special strategies to cope with other noises. In church and other crowds, I had to sit in the back row and never stood for standing ovations, so that my ears were slightly below the sounds of my neighbors applauding in the crowd. At restaurants, I requested seats far away from the kitchen, main traffic area, kids, and usually in the corner, so that the waitress could not come up behind me and ask for my order, spooking me. Soon I quit going to church altogether. It was much easier to watch the sermon on TV in the quiet of my house. I also had to quit going to concerts, movies, shopping, and dancing, much like Dave did. I could not stand thunder, mowing equipment, fingernails tapping or scraping, and certain people's voices, and soon had to avoid places where I might encounter these sounds. I had to retreat to the silence of my house. But there was no silence. I could still hear the refrigerator running, the air conditioner blowing, birds chirping. My girlfriend said, "Just close your eyes, and the traffic will sound like waves rolling in on the beach." Well, she's right, but I didn't want to hear that either. I also could hear the bubbles in my Coke while I was watching TV. They say, be careful of what you wish for. But there were many times that I wished that I was deaf. I envied people who were hard of hearing because they lived in a silence that I could only dream of. Once I even asked my doctor, when is old age hearing going to set in, because I'm waiting? At times I felt like I was going mad. Friends started avoiding me when I snapped at them for making even the simplest of noises, and I worried about slipping into isolation. But I loved being with people, if only they could be quiet. They just didn't understand. Heck, I didn't understand, and neither did my doctors. They all said, "You should be grateful you have such great hearing." Yeah, right. A friend of mine once took me to his hearing aid doctor, who was amazed at my hearing, and gave me very good molded earplugs. And for a while I could participate in life again. And I was resigned to the fact that this was the best that anyone could ever do. But when I needed replacement and the doctor had passed away, I was out of luck. Then in May of 2015, I answered the ad in the newspaper for the Silverstein Institute. The response was very hopeful, and after the first appointment, wow, Finally, there are people who understand that this is not only a real problem, because I had a lot of people that didn't believe that, but there was a real treatment for it. Now I have gotten the winning lottery ticket, because I never dreamed there was any hope for this strange condition that no one ever heard of. And after the surgery, I noticed some differences right away. I still hear very well, but noises are not so annoying, startling, and painful as before. And I have less anxiety because I am not constantly on guard for noise. Mostly my friends, and not so friends, notice the difference. And they notice that I am calmer, talk softer. Oh, and I sleep better because I don't wake at every little sound. And better sleep leads to better health. It's amazing and gratifying when people apologize to me for making some noise I used to make and it doesn't annoy me anymore. And one friend said, "Boy, you barely noticed it. You don't know how better you really are." Yes, I do. And thanks to Dr. Silverstein. Thank you, Dr. Silverstein. I'm starting to enjoy shopping, dancing, and all the other things I used to enjoy. Without fear of noise, and it is so great, and I really am thankful to you, really, really. Thank you.
You're welcome. She had her surgery in July of 15, right?
Yes.
Yeah, so this has gone on almost 3 years now. So she's doing very well. So who's going to be next?
I will.
Okay.
Hi, my name is Gayle Loss here, and I wasn't quite as bothered as poor Alona was, but I can't remember a time when I didn't have sustained noises bother me. When I was in junior high, I remember a time coming with a group of friends to the city park at the end of my block. I lived on a dead-end street, and I could hear my parents' TV 4 houses down the way, blasting away, hurting my ears. I was so embarrassed, but it appeared that none of my friends could hear it. So I was safe in that situation, but they didn't connect any noise to my house anyway, if they heard it. I know now because it wasn't painfully loud to them and it was to me. My mother wore hearing aids later in life, and most of the sounds in her house were way too loud for me, but not painful, so I survived, and I was never really in terrible pain. I've almost always had to ask somebody to turn down the car radio just a notch or two so that it doesn't make my ears hurt. I was real popular with my teenage kids. And thankfully, I have a really understanding husband who, whether he likes it or not, he definitely turns it down. On one occasion, I remember we were discussing some retirement options with a person who had a calculator. And I said, "Could you shut your calculator off? The buzz of that thing is driving me nuts." And both of the guys, my husband and the fellow, said, "What buzz?" I said, "It's buzzing and it's hurting my ears." Well, they sent me out of the room and said, "Okay, can you hear it?" And I said, "Yeah, it's on, it's off, it's on, it's off." I could hear it a room away and they could not hear it. Those kinds of things kind of did drive me nuts. Most movie theaters were, and frankly still are, way too loud for the human ear. Nobody needs to listen to it that loud, but it did bother me a lot. But they have become much more enjoyable because my ears don't really hurt. I read about this seminar a few years ago, and I told my husband I thought we should attend because I thought I might have what they were describing. And he agreed that we should come, and after listening to Dr. Silverstein and the panel, I decided to have my ears tested. Turns out that I did have the problem. I had surgery on my left ear on May 11th in 2016, and the surgery on my right ear exactly 1 year ago today, December 7th. When tested for noise before the procedures, my tolerance level was quite low. It was around 80 dBs, I believe. And the last test that I had indicated that I could listen to the test sounds, all of them, without any pain. I now am much more comfortable in noisy situations, and I'm certainly glad that I decided to go ahead with the surgery. And if you're considering it, I can honestly tell you the recovery from the surgeries was very easy. The worst thing was putting some stuff in, drops in your ears and cotton, and virtually I had no pain at all. So I do thank you So I wasn't so severe, but it certainly is a better life. Thanks.
Thanks very much. Ed, you want to talk a little bit?
Yeah, my situation is a little different.
Ed Messner.
Ed Messner, right. I had my surgery, well, just this last June 7th, I believe. I was always very easy for me to distinguish sounds. I used to be able to tell years ago when all cars had different engines. I could tell without seeing a car coming from behind me what kind of car it was and whether it was a 6 or an 8-cylinder engine. So I was attuned to sound. I sang in barbershop quartets, and so music is important, and sound has been very important to me. However, due to teaching woodshop and doing other things like that, I exposed my ears to a lot of sound over the years, and I have some hearing loss as a result of it. Along those lines, on June 8th of 2016, about 10 o'clock in the morning, I remember my wife and I, we were working at the cottage next door to our place up in northern Michigan, and I struck a board with a hammer, and my head was very close to it. The board was like here, and I hit it with the hammer, and all of a sudden I got this, what was described as a bombastic trauma or something to my, at least that's what one doctor told me. And from then on, that was it. Carol would be moving some dishes around, or even I would be moving dishes around. It would drive me nuts. If she sneezed, I would just about literally jump up and be in terrible pain and anxiety from that. Even driving on the road, I can tell the difference between a blacktop road and a concrete road. Coming back to Florida, I even with a plug in my ear. It was still bothering me. I tried to stop at a Cracker Barrel restaurant. That didn't work. I had to leave because it's very, very loud. So when I heard about this possibility, after seeing several doctors up north, one down here, give me a lot of steroids, a lot of other different medications, didn't do anything. They thought it was a temporary injury that would revert because it happened. The onset came on so suddenly. So since I've had the surgery on, like I said, this last June, the condition is much improved. I'm not sure if I need it in the other ear or not, but I can tolerate dishes in the dishwasher. I think my wife can probably attend that. I attest that I do better around sounds and people, and it's easier. She probably feels like she was walking around on eggshells, trying not to disturb me. So that's pretty much my story. I definitely have improved tremendously, and even though I probably do need hearing aids, it's kind of funny that this problem can be, you can be sensitive to sounds but still have a hearing loss. And that's the way it is in my case.
Great. Thanks, Ed. Carol Carol had her surgery in 14. See, when was it? It was May in 14. She was the second patient to have it done.
I found the operation itself and the recovery very minimal. Little pain, and it was done without even an overnight stay in the hospital. I often get asked how much better I feel since the operation. Better than last year, better than the year before. They're difficult questions to answer because hyperacusis not only affects your sensitivity to noise, but affects your whole body, and each individual is affected in different ways. I would probably feel terrific if it wasn't for my aches and pains of old age, back problems and that kind of thing. With tinnitus for over 40 years, tinnitus has kind of formed a partnership with hyperacusis to impact the quality of life of many of us. All that being said, I remember back to the days when I was working and then retired, the days before I met with Dr. Silverstein. the days before I even heard the word hyperacusis. I was the happiest when I didn't have to go anywhere, when I could stay home and not deal with the sounds of other people's voices, especially when in a crowded room with bad acoustics. To be honest, I felt like people were just yelling directly in my ear, and I just wanted them to shut up. I no longer took pleasure in a long drive in my convertible, and just the thought of it would stress me out and cause my blood pressure to rise and make me feel uncomfortable. Now, years after the surgery, I've been doing a lot of things that people with hyperacusis would love to do but can't. Within the past year, I took a cruise to Alaska, stayed for a month to visit our family in Greece, along with their 2-year-old, and now planning for another cruise this month. Instead of dreading the thought of a crowded flight or a noisy ship, I can deal with it, even though I do wear earplugs on occasion. There are still times noise does bother me, and I know I'm not completely cured, but I feel my quality of life has improved significantly, and it is my sensitivity to noise does not seem as severe, and I would recommend the operation. Danny?
Thank you, Carol. Diane?
My name is Diane Maugeri. I guess most of my adult life I've had very sensitive to loud noises. And the way it affected me was that if the noise was too loud, I actually had pain in my ears. But even when it wasn't terribly loud, my body would react to every different noise. If a fork would drop, if a dish would drop, if somebody would come into a room and all of a sudden spoke out loud with passion, we'll put it that way. To me, it was very, very loud, and I was spending my life around people being startled. And what happened was, it made me very anxious. There was a long time I suffered from anxiety, and there was a dread every time I knew I had to go out and I had to be around other people, because everyone has a way of expressing themselves, some people more loudly than others, and when people are passionate over something, they do get loud. And I think for me, for a long time, I didn't know what I had. I didn't know other people suffered from being so sensitive to noise. And for me, it was hard, even for being with my family. I've been married a long time, but I did marry into a family that was very boisterous, very loud. And this made it hard for me. Every time we had family gatherings, I could tolerate maybe 10, 15 minutes in the room with all the people I loved. And then I had to go in another room by myself, find a book or magazine, and that's where I spent the rest of my time. And it was hard, very hard to look forward to gatherings of any kind. And as the years went on, I avoided restaurants. When my husband and I went on vacations, we didn't eat lunch at lunchtime. We would keep fruit in the car, and then we would eat our lunch at 2 o'clock when the restaurant had maybe 5 people in it. Everybody was back at work. We would eat at odd times just to go into a restaurant where there were very little people, and we'd ask for a booth way in the corner. This is how I lived for a long time. And then, like many of you, I came to a seminar like this and met Dr. Silverstein and found out exactly what I had and came to him for tests and so on. I had the surgery in one ear, and I noticed the difference, and I'm ready for the second ear. And I have to tell you, like others, there was no pain with the surgery. Everybody was so kind, and you wake up and of course you have packing in your ear. And that's about all I felt was something in my ear, but no pain. And when the packing comes out, I noticed a difference, and I want to get the second ear done. And I would just recommend this to anyone because it does make a difference in your life. Thank you.
Thank you very much, Diane. Rona?
Can I come up there?
Sure, whatever you want.
Hi, I want to thank Dr. Silverstein for inviting me to be on this panel. My name is Rona, and I practiced dental hygiene for over 30 years. In 2008, I noticed that the suction was hurting my ear, my left ear. Then the pain got more severe to more sounds. I went to so many doctors, including the Cleveland Clinic, and no one knew what was wrong with me. My friend found the Hyperacusis support and research site through Facebook. Through that site, I learned a lot about hyperacusis. I made an appointment at Massachusetts Eye and Ear. They told me they can diagnose, but they don't treat. I couldn't believe it, so I became very distraught. I posted my appointment on the Facebook site, and I got a reply stating, "Why are you coming north when everyone is going south?" I was speaking to a really nice guy from New England who suffers as well. He told me all about Dr. Silverstein. We actually scheduled our appointments on the same day so we could meet each other. I had the surgery 2 times on my left ear. The first surgery was on October 12, 2016. I found the surgery to be very easy. The packing I found difficult and uncomfortable. The first surgery, Dr. Silverstein discovered that my stapes bone was too loose. That loose stapes bone had my brain stinging every day like a broken bone. That tiny bone caused me so much pain. Thank you, Dr. Silverstein, for discovering it and repairing it. So at the beginning of this journey, I really had no idea what hyperacusis was all about. My brain was always stinging and sounds caused physical pain. The surgery has given me a small window of relief to the lower decibels, such as motorcycles, trucks on the highway, honking of a horn, the lower ranges. Sometimes I will say out loud, "Wow, that didn't hurt." I still suffer from a variety of sound frequencies that cause pain. Examples: retrieving ice cubes, utensils hitting the plate, water hitting the sink, trucks beeping, opening up a bag of potato chips, the TV, cell phones, plastic bottles, doctors' waiting rooms, my own voice, and the wicked leaf blower. I also put felt in between all my dishes. By 6 p.m., I feel my ears ache, sting, feel full, and burn after a day outside my home. In June 2016, I received a call from Dr. Silverstein. He said he wanted to go back in and add more tissue. He has been seeing more cases like mine, and he wanted to do this for me. I was thrilled he was thinking about me. I had the second surgery. I found after that surgery my ear was a little calmer. Same result as the first post-op. I feel I got maybe 20% improvement with the lower decibel sounds. When you get any improvement at all, it is huge. Dr. Silverstein went the extra mile and found I had 2 issues going on simultaneously. I am so ever grateful to Dr. Silverstein. Thank you for listening to my story. Thank you, Dr. Silverstein.
Okay, we'll open up the meeting to the audience. They could ask the panelists anything they want, or ask me anything they want to ask.
Dr. Silverstein?
Yeah.
How many procedures of this have you done? Have you done like 10 times as many are here, or?
We've done about 20, 25 patients now since 3 years.
Thank you.
I wanted to ask Diane, is it? Can you be more specific about how you've improved? What you can do now versus...
Give her the mic.
My improvement with one ear has allowed me to go to the movies which I couldn't do before. My husband and I, he's retired now, so we do go more often to restaurants. I don't have to always skip the lunchtime when there's a lot of people. I can still go into a restaurant. I enjoy being around people, and I can even tolerate. My husband and I attend church, and the music sometimes gets quite loud during worship, and I can tolerate it okay. I don't have pain, and I don't have to leave the room. And these are the things I couldn't do before, but I am looking forward to getting the other ear done. Yes. This past year, my husband and I went back up north, and we celebrated 50 years of marriage, and after our trip, we stopped at his brother's house, who was quite loud, and even my husband shaking his head. I mean, and we stayed there a week, and it was fine. I could tolerate him. It was a little loud for me, but not the kind that where I'd be jumping, or wanting to leave the room in 5 minutes. So there has been a change, an improvement, and that was with one ear done.
And what were your ULLs prior to the surgery? Do you remember?
No, I don't.
I'd have to look that up. Here, let me see. I may have this here for you. We'll see here in a second. No, what's interesting is the second ear that hasn't been operated on, most of the patients got better after the first operation. We haven't figured out why that's happening, but their ULLs go up also. Not as much. And I don't have the, I just have the op note, I'm sorry. But that's another good question that you asked, so let me talk about that. We have some patients that the ULLs don't improve, and yet the patient is improved. And I'm not sure that that we can rely 100% on the testing, because the testing is so subjective, and it changes from day to day, and the tester is different. So it's really what the patient. If we didn't use the ULL test, it wouldn't matter, I don't think. So it's really what the patient feels and what they can do after the surgery.
Yeah, back here.
Yeah.
Oh, me?
Yeah.
I'm just curious, because I'm one of those people who had probably undiagnosed concussion from an accident. I didn't get very good treatment at the time. And this came on after that. What is the mechanism that causes the problem right after an injury, I guess?
How long after the accident?
I think I had pain pretty quickly, but then the ear started to come in, and I think it was probably 3 or 4 years before I was really complaining about it, but it all started from that.
Well, everybody is different, and it depends upon how much injury there is, how much the inner ear is shaken up by the trauma, and I don't think we have a good answer for it. We just know that trauma definitely causes it, as you've heard several times, and it can be right afterwards, or it could be delayed a couple months or a year. But obviously the trauma injures the ear, and then the ear starts ringing more.
I thought it was my neck, I think, so I put it away, I wrote off the ears because I thought it was my neck causing it.
Your neck can cause a lot of problems too. Yep. Yes.
Is the procedure done in the hospital or?
Yes. The procedure, it's about a half-hour procedure. It's done in the outpatient surgery center across the street. And there's minimal pain or discomfort. You go and get the surgery, and you go home the same day, a couple hours after the surgery. And then the packing comes out a week later.
Most of the time, it's just 1 ear that's done at a time, 1 ear?
1 ear. We always operate 1 ear at a time. In fact, we've been waiting 6 months to do the second ear. because, like I said, that the second year many times gets better after doing the 1 year, and we want to see what they're going to do with that 1 year, how much better it gets.
What about people with tinnitus or tinnitus, however it's pronounced? Is that affected one way or the other?
No, it's not affected at all. And so you've got to treat the tinnitus with masking. With we have maskers in the hearing aids now that play chime music. It's called the Zen device, and but tinnitus has to be treated with masking with other sounds.
Yeah, my symptoms are not similar to some of the other people's, where I'm not sensitive to loud noise. My car, you can hear my music 2 cars away. It's different sounds. For example, when we were sitting here before you came out and just people were chattering, I almost felt like I had to leave because there was so many things going on that I wasn't.
So it wasn't the loudness that bothered you?
It wasn't the loudness that bothered me. No, it was, you know, I've done this in family gatherings when everybody's talking, you know, cross conversation, and I just go, I can't handle it, and I'll leave the room.
Right. That is not going to be helped by this surgery, for sure.
Like commotion or something, or like, commotion.
Yes.
I'm glad that you brought that up, because my difficulty is also not the difficulties that I heard. My difficulty personally is that when I'm with a lot of people, even we had Thanksgiving with 81 members of a loving family that were so glad to see us in California. Okay, so that's big trip to California. Loving, loving family, but 81 of them. And when, at the end of the first day, my daughter was driving us back to the B&B where we were staying and said, Mom, what did you think of this? And there was no quick answer. And she said, oh, Mom went into her Zen period. Because after that constant, I just went into, I can't process anymore.
Okay, this is not hyperacusis.
And that's my...
Yeah, that's not what we can help, unfortunately.
Yeah.
Hi, Dr. Silverstein.
Hi.
Hi. My husband and I are really here to become educated about this because our daughter, who lives in Chicago, was diagnosed with this. But having heard everybody on the panel and others, her hearing problem isn't as severe, although we notice that it is becoming isolating, I think, for her. Anticipating, I mean, things like air conditioner sounds, nothing hurts her. She never has mentioned any pain. She does go to movies, she goes out with friends, but at the same time, she's moved to different places because there's been either noise in the place next door or up above, or she's so conscious of, I noticed this the first time she came back to our house in Connecticut, and I had high heels on, and she was upstairs at the balcony kind of thing. And she called down, she said, are you going to wear those shoes all afternoon? You know, meaning that it was, the noise bothered her. I don't know if you have a moderate case of this, if there's anything that she just has to live with it, or is there anything that can be done?
Misophonia or a different type of noise sensitivity than hyperacusis.
She does. She does.
Something a little different.
I wish there was something that could be done.
You can have both, though, right?
Yes. Yeah, you can have both.
You
right.
can have
exactly.
Loud noises bother you as well as the other. So
yeah, exactly.
In that case, I mean, we can help you.
Well, we'd talk about it. We would tell you what it would help and what it wouldn't.
Does the hyperacusis continue, does it continue to get worse?
It seems like it has been for a lot of these patients. It seems like that's why they come to the surgery, because it seems to get worse over time.
Thank you all for coming. We appreciate you being here.